Hello everybody, update from the Trust Board that we held yesterday. We had a lot of things to talk about, but the focus and emphasis, sort of theme running through a lot of our conversation related to our staff, which as you know is one of our strategic priorities to enable staff to do great work in the organisation. And I just wanted to reflect how that conversation related to our new values. It's really important that we keep thinking about how they inform what we do. Trust, honesty, respect, compassion and teamwork. A lot of the conversation reflected on the pandemic. We're past the peak, but it's clear that it's going to be with us and the effects are going to be with us for some considerable time. But we've undertaken a massive amount of work in a whole range of areas, including making sure that access to testing for both the active virus but also antibody testing. So we've had over 7,000 of our staff have had tests now. We've worked to continue to recruit and to make sure that we can offer some form of induction, and we're looking at how we can get face-to-face training back up and running. We've done an amazing amount of opening up of a health and wellbeing service, and something that through a KISS survey, which is Keep, Improve, Stop and Start, we had over 1,400 responses, and one of the key headlines from that is that over 93% of feedback was that our support around health and wellbeing for our staff seemed to be really positive. So that's a tremendous piece of work that so many people have been involved in. A bit of reflection around equality and diversity. It's really heartening to hear that there's been a very significant increase in the number of people joining our BME network. So over 60 new people joining that. So it's great to see that becoming even more inclusive. And we've had a 99% completion of our risk assessments for BME staff, which again was a tremendous figure to achieve given the spread and diversity of our organisation. So fantastic work there too. A couple of other headlines. We had some detailed conversations around the long-term plan for the future mental health services, with a particular focus on our locality or community mental health teams and the transformational requirements to enable them to broaden their access, target specific patient pathways with a real focus on improving quality of outcomes for patients. And it's also heartening to hear, both nationally and regionally, that mental health remains a priority, and that we have already received some additional funding for the mental health service, and we're optimistic that more will come through the rest of this year and into next. And then finally, as ever, to mention the CQC, we continue our preparations across the organisation. You'll know that the board is also involved in preparing for a visit which could happen any time. We had an unannounced inspection of some of the adult mental health wards a couple of weeks ago, and the initial feedback has been quite positive, and that fits nicely with the recently published report that we had from Rampton. So from a CQC perspective, we're confident that we're moving in the right direction. And I want to thank everybody that's been involved in all this work across the organisation, and hope that you have a chance to look in more detail at some of the board work, but also that you get a chance to take a break during the holiday season. Thanks very much.